Hey guys, I'm Scott with Before You Buy, where we do product review videos to make sure it's what you want before you buy it. But today we're turning the page a little bit. We're doing product demonstrations. And I got my friend Jacob Pauli here, who's a national champion pole vaulter, professional pole vaulter, and has done insane amounts of self-treatment to basically stay alive.
Yeah, that's true. There's been times during my career, I'm long past retired now, but during the end of my career where I was really beat up and I had to get really creative to figure out how to take care of some of these injuries that I've had.
Yep. And now you have ongoing things because of that work you put in.
Yeah, absolutely.
And now I'm starting to feel it. I'm 39. I'm doing American Ninja Warrior, trying to keep up with these young kids. And now I'm feeling it. So I'm coming to Jacob asking, hey, how do I self-treat this? So he's helping me. Today we have the Hypervolt, but I have all kinds of massage gun review videos. So make sure you go check those out if interested in your own. But this topic will be on knee pain. And doesn't come from your knee joint, right? It's muscles pulling on it. And for me, Jacob knows way more about this than me, but for me, it's always my IT band, it seems like. I get that massage gun up in my hip area, go down that IT band, like I'm crying like a baby.
Yeah.
I used to use a roller. Sometimes I couldn't even put weight on the roller. So that's one thing I like about this is also I can watch a movie with my family. These things are quiet enough that I can just treat at the same time.
Yeah.
But knee pain, where does one start?
I think exactly what you said. I mean, a lot of times, especially it's so simple if you keep it simple. A lot of times, lateral knee pain will be coming from the IT band. In some strange cases, you would get the part of the calf or this peroneal muscle could possibly be causing it. But a lot of times, that IT band, and normally, I think in one of our other videos, I said treat an area for 2 minutes, maybe 3 minutes. IT band more like 5 minutes. That is a dense, thick. It's basically a thickening of the quad, yeah. And if it gets tight, we're talking very, very strong muscle. And you can spend, as long as you're doing okay, keeping it relaxed, you could spend 3, 4, 5 minutes on a single IT band. I wouldn't worry about that. Yeah.
And that was key, is making sure that your muscles are relaxed. I've seen some people stand up and putting all their weight on it as they're massaging it. That's the opposite of what you want to do, because that muscle's fired. You want to relax that as much as possible.
Absolutely.
Is that right?
Absolutely. Yeah.
Sometimes, if Jacob's, giving me some tips, he'll say to lengthen and shorten the muscle too, though.
Yeah.
What about the IT band? There's not
really
really a way
tricky on the IT band. We can on the other part. We're going to go over about 4 different ways that we can treat the knee. But
how about I just hand this over? Let's go to town.
I'm glad I know where the on button is now. But IT band, just like you said, you got to release the IT band before you start working on it. Even if you are standing and you just like drape that out to the side, I can start working on the IT band right there. But along with that, you have the vastus lateralis, which is an oblique muscle, and it runs like this. And it's the little brother of your VMO or your vastus medialis. This is a nice little scientific thing.
This guy.
And the O in VMO stands for oblique. So these muscles, I'm going to just lay that down, keep it going, are running this way. And so keep that in mind as you, sorry. And
it's okay.
Hopefully these things can turn on and off a bunch of times. And so now let's just work on you here for a little bit.
Okay. So what do you want me to
go ahead and just lay down.
Lay down.
Just like that. And this VMO is that teardrop muscle that you see if you're as jacked up as Scott is here. Right. And you can work through that. And a lot of times that is going to light you up. And that could be painful.
I'm feeling it, yeah.
So if you have any medial knee pain, you might want to start here. If you have this outside knee pain, IT band, inside knee pain, this VMO teardrop muscle. And that thing runs right into your adductor as well. So you can get fancy there. And then quads, and then, get ready for this anterior tib, or the front of your shin. Okay. Sometimes if you have a tight this and a tight that, they're both feeding into this joint, you're going to feel it here. And so you can come down and start working the fronts of these shins, which is nobody ever takes care of this muscle. And this thing's beat to death. How's that feel?
I'm feeling this, actually.
And again, this is about self-treatment. You can do this yourself. It's going to take a little practice getting down to the shin and not firing it while you're trying to work on it. Wow. Basically, here you are. And then we talked about shortening and lengthening. If you do have somebody to help you, good for you. Having a friend is nice.
That's right.
You can lengthen this thing and shorten it and lengthen it just like that. Just it's a little added mobility, I think, because you're.
And the reason you need the friend is because if you do it yourself, you're flexing that muscle.
Exactly.
Yeah.
Exactly. So yeah, basically around the knee. I'm never coming down on the knee. I'm never trying to get fancy and going like into here. I don't think that would be much effective. Even this patellar tendon, I probably wouldn't even get on that because that can get a little irritated too. But all the stuff that feeds into the knee, absolutely. And just flip over real quick. Last one here.
Oh, jackpot.
This one is what I call the mystery muscle. I just made that up on the spot, by the way. I don't call it that. This is the popliteus. I used to fly internationally to go to track meets, and I would get off the plane and think, that's, I am swollen back here. But it wasn't swelling, it was tightness. And this popliteus back here gets a little tight if you have a hamstring feeding into it, or if you have a tight calf feeding into it. And this guy, how's that feel? He's laughing. So it's good or bad.
Yeah, it's a hurt so good laugh.
And this is one of those that you want to be careful with. You will not be able to treat this on your own unless you're sitting down but you might need some help with this. But you want to not put pressure. You're just, the weight of the gun is all you need here. And you're just working around that popliteus muscle. And here's another one where you can kind of get to the base of the hamstring here, shorten and lengthen, just moving as you're going. And then kind of take care of that area as well. But that can also cause some pretty strange knee pain.
Yeah.
That a lot of people would not see coming.
Sometimes I even feel the knee pain under my knee and like under my kneecap.
Yeah.
And then I get scared and I Google it and no, it's still coming from the IT bands.
Many times, yes.
But when he was hitting my shins, oh man.
Yeah.
Definitely felt that too.
Yeah. Nobody takes care of that area. They really should.
Right. So hopefully this helped, and you can do this as preventative maintenance. Even if your knee's not quite hurting yet, but you went for a run, go ahead and use it. Prevent that muscle from getting over tight. Hopefully these videos help. There's a whole playlist of these. Thank you, Jacob, for joining me.
My pleasure.
And till next time, see ya.